Hello to everyone, and in this video we'll be discussing on the topic of our brief discussion of the thoracic aortic aneurysm. So first of all, what is aneurysm? Aneurysm is an pathological enlargement of the section of an artery. Okay, so it is a simply pathological word which is used for the disease of artery. So there is aneurysm is just a ballooning, you can say, or bulging of the artery in anywhere. So in this we are specifically discussing about the chest aortic aneurysm, that is the thoracic aortic aneurysm. So aneurysm is a pathologically enlarged section of the artery. So for respect to this thoracic aortic aneurysm, there is classification on which we will divide. First one is by etiology, that is the origin. So it is as a result of atherosclerotic plaque or degenerative damage. And atherosclerotic plaque, there is a deposition of the plaques in the arteries which can lead to the further bulging of the or ballooning of the thoracic aorta. So in this case there can be this cause also according to etiology, and degenerative damage, it's a meaning related to the disorder of connective tissue, in which we have one pathology which is called as Marfan syndrome. So Marfan syndrome is actually a deficiency of proteins or disorder of connective tissue in which the person is having a long thin bones. Okay, so his posture is not okay, long fingers, long bones, long arms, and it's suffering from the deficiency of development of the growth of the body. So this is an complication. If the patient is having aortic aneurysm, he or she can develop cardiovascular complication which is called as Marfan syndrome. So there can be in shape, you can also divide, that is called as baggy and fusiform shape of aortic aneurysm, and you can also divide by structure of wall. These are third point, and real and pseudo wall, and you can divide according to the clinical picture, means how the patient present. Patient can be asymptomatic, patient can be symptomatic, and patient has some discontinuous course of disease. And by the location, you can chest. This aneurysm can be located in the chest cavity, or is often and specifically located on the ascending part of the aorta, and it can be located below the diaphragm, or it can be located in the abdomen area, which is called as thoraco-abdominal aneurysm. So these names are according to the location. So first of all, see this thoracic aortic aneurysm, how it looks. You can see this is the aorta. So this is actually thoracic aorta till the diaphragm. So you know that according to anatomy, there are T12 level from where your thoracic aorta continues into abdominal aorta, from your internal organs or abdominal organs begins, and above the part is your thoracic part, that is called a chest part. So in that we have this thoracic aorta, in which we have three parts. First is ascending part, then comes your arc of aorta, then comes your descending aorta. Okay, and after that is your abdominal aorta below the diaphragm. So that is the basic anatomy here. So if you can see, this is your healthy thoracic aorta, and this one is your thoracic aortic with aneurysm. So you can see this is your thoracic aorta, this bulging you can see here, and this is zoomed or zoom diagram of this. You can see this bulging or ballooning in the artery. So this ballooning or bulging is called actually as aneurysm. So it is present in the aortic thoracic aorta, that is why it is called as thoracic aortic aneurysm. Okay, so this is the basic concept behind the aneurysm. Now the patient, how the patient will present symptoms. First event will be embolic or stroke or ischemia. Okay, and the risk factor is related to the size of aneurysm. So the risk and the symptoms are related to the size, what is the size of the aneurysm, and the compression or damage to the adjacent tissues by the dilated vessel. So if the ballooning is very large, or very large bulging is there in the artery, so it can infect the adjacent organs and tissues, and which can further lead to the other complications. Okay, so that is the main which will be depending on the size. And now comes your chest pain, which will be the basic symptoms: shortness of breath, cough, hoarseness, dysphagia. Okay, you have a problem with the swallowing because it is present near the esophagus, so there will the patient will come with the problem in the trouble in the swallowing. There can be dilation of the ascending aortic aneurysm, can cause congestive heart failure. So if the ascending aorta, you can say ascending aorta, this part ascending, the ascending part, if there is any dilation in this section, so there are chances of developing congestive heart failure, CHF. Now what is the diagnosis? If we talk about the shapes, you can see this diagram. This is your aortic aneurysm. In this part you can see the bulging here. So this is a descending part, actually descending part of your thoracic aorta, or according to anatomy. So this is the fusiform shape of aneurysm. So this name is according to the shape of the aneurysm. Location is same, it is present in the chest. Okay, so this is thoracic, but there can be circular also, like the shape of bulging can be there in the artery. So it depends on the shape, that is why its classification on basis on the shape. Okay, Now comes your diagnosis. What the diagnosis you can do with respect to? We can do the chest X-ray to find any expansion or shadow of the mediastinum, because the aortic aorta passes in the mediastinum, between the mediastinum, the posterior and anterior. So that is why in the chest X-ray we can see any expansion of the mediastinum. That will give us the point to relate with the differential diagnosis of this thoracic aortic aneurysm. There can be chances with chest X-ray we can do, or any type of displacement or compression of trachea we can see in the chest X-ray. So that can also be helpful for us, and we can do ultrasound for the abdominal aortic aneurysm. So if the aneurysm is in the case of abdominal area, we can do the ultrasound. So there we can diagnose it. Now so we can do CT angiography, which will allow to accurately access the size. What is the size of the aneurysm? Okay, so that is the CT angiography. Now comes your MR angiography, which is also used to see the size and the extent of the aneurysm. So these are the instrumental diagnosis which we will do. There can be intravascular ultrasound that will give you an image of the aortic wall from inside by introducing the ultrasound sensor through the catheter. So this is a modern technique which is called as intravascular ultrasound, which can also help an asymptomatic patient whose aneurysms are too small or to warrant surgery or non-invasive. So we can, for that we can do contrast CT MRI is done at least every 6 to 12 hours, at least 6 to 12 months in the cases of asymptomatic patients. Now what are the risk factors of thoracic aortic aneurysm? So the people who are age of 65 and over, they have the risk, and people who are eating tobacco, and the patients who are suffering from arterial hypertension, BP patients, the patient with the atherosclerotic damage to the vascular bed, obesity, and any type of lipid abnormality. So that patients or those patients are prone to develop thoracic aortic aneurysm. Now and relatives who are having a genetic predisposition in the earlier aneurysm case, so they are also more prone to develop this pathology. And the patient with the Marfan syndrome are more prone to develop, and the bicuspid aortic valve. Okay, so these are the risk factors which the persons can develop. Now what are the treatment in the case of this thoracic aortic aneurysm? So first of all, we have endovascular aneurysm repair, which is called as EVAR. Okay, so the surgeons repair by inserting a metal mesh coil inside the artery and decreasing the size of the aneurysm. And the medicines is according to the symptoms. That is, the patients who are having lipid imbalance is the any risk factor, so they are on the statins and the medicine, and who are patients with high BP, they are on the beta blockers, losartans, ARB and ACE inhibitors and all. And we can manage this treatment by decreasing the risk factors like cutting, smoking, controlling the blood sugar of the patient, and losing the weight, doing exercise, or forming a healthy diet. Okay, so these are the treatment we can do for the patient. And you can see in this diagram, this is the diagram which is endovascular aortic repair. So you can see this is an aneurysm, and this is a stent, which is called as surgeon repairs by inserting a mesh coil. So this is your mesh coil, you can see. Okay, so this is the mesh coil, you can see this is aneurysm, and the patient insert here, or surgeon insert this mesh coil inside this thoracic descending aorta, the part of the thoracic aorta. So this is the surgical treatment for the thoracic aortic aneurysm TEVAR. Okay, thank you.